All right, so in this video, we're going to take a journey through the lovely leg muscles using this fun model for us today. All right, so as you work your way through the leg, it makes the most sense to kind of pick some landmarks. And so for us, we're going to start at the top and then we're going to work our way down. Muscles are always going to be in the same relationship to each other that you find in any picture, any diagram, or cadaver. So finding those relationships will help make a lot more sense. If you look off of the ilium here, you're going to have a muscle coming down. That's going to be your iliacus. Over here off of what'll be the vertebrae, it's going to be your psoas major. So those are the two up here in the pelvis. The psoas major and iliacus, once you cross this ligament here, merge and form one joint muscle, so the names of them join. So we have the iliopsoas. So that's the landmark I use here. So then I start with iliopsoas, then I go pectineus, adductor longus, adductor magnus is the little one sticking out here, and then gracilis is the long one that goes all the way down. So the trick here is gracilis is the groin. Now with your adductor muscles, there are three. If you look at longus on this model, it doesn't seem very long, but it does continue quite a ways all the way down to through that femur. If we take this one off, you would find your brevis hanging out really small underneath. And so think brevis as abbreviated, meaning the smaller muscle. The magnus, as we mentioned, is going to be the one that was right here, right next to it. You can see more of it even now that I've removed that longus. And if we rotate it a little bit, you can see a lot more of it through the back. So it actually is magnus, meaning large. So it is the largest of the three. All right, so once you get those landmarks down of kind of how you work your way through this angle, then let's pay attention to the big one that makes a sash. It looks like the letter S because it starts with the letter S. So this is our sartorius. Sartorius is going to wrap around, and so it'll be on the lateral side, going from the anterior superior iliac spine all the way down to the medial side at the knee. So it will have actions at both the hip and the knee joint. Other muscles that are also going to have actions with the hip and the knee make up our quad. They're called quads because there are four of them. They will all work in conjunction to extend the leg. Remember, the leg is everything below the knee. Up here, we call this the thigh. So they'll extend at the knee. You have your vastus lateralis on the outside, vastus medialis on the inside. This one here is our rectus femoris, and underneath that rectus femoris, so I removed the sartorius so we can see them a little bit better. So here's that vastus medialis again, vastus lateralis on the outside, rectus femoris. If we take the rectus femoris off, right underneath we have a vastus intermedius. The rectus femoris and the vastus intermedius are in the same location. The way you tell the difference is you look at the fiber directions. This one kind of looks like a chevron pattern. You have some on this side going this way, some on this side going this way. So they make this little triangle pattern. If you take that off, the vastus intermedius, the fibers here run up and down. So that's how you tell the difference. Okay, so if we put those back and work our way now down towards the lower part of the leg. So now we're going to work on the muscles that will start up in the leg and work their way down to the foot. So these will have actions on the foot because remember with your muscles, you have an origin and insertion. The origin is the part that's your anchor. The insertion is the part that's going to move. So these start up here and they're going to move at the foot or ankle. Our first one here is the tibialis anterior because you're in front of the tibia. So the name tells you what bone you're in front of. So tibia. And then anterior because you're in front of it. So tibialis anterior is going to reach all the way down in front. So it would cause the front of the foot, so the toes, to come up. So that's going to be pushing the heel down, lifting up on the toes, a dorsiflexion action. We'll have the same thing with this one here coming down, but this one will fan out. And so you can kind of see all the little fibers going to each of the toes. So that's going to cause the toes to come up with the extensions of the digits. As we work our way to the side, now we're going to be by the lateral bone, the fibula. So we have the fibularis longus, which is the top one, and then underneath it a shorter one, so we call that the fibularis brevis. So fibularis longus, fibularis brevis. Fiber direction changes a little bit. That's how you can find the brevis, is it angles in a little bit more than longus that runs more up and down. They're both going to wrap around, come underneath that lateral malleolus to come to the outside of the foot. So it can cause the foot to roll out. So it's an eversion action. After working our way through the fibularis longus, fibularis brevis. Oh, and by the way, the other name for that is peroneus. It's an older name, but you can call it peroneus longus and peroneus brevis. There's a little bit of a gap there, and that will get us to what commonly people refer to as our calf. We have the gastrocnemius and the soleus. The soleus is the one underneath. So the soleus is the deeper one. Gastrocnemius is the really big one. So when you look at people's calves, when they've worked out a lot, sometimes you can see that little divot or that V here. So this is the gastrocnemius. It will go down to the heel through the calcaneal or Achilles tendon. If we lift this, it pulls the heel up, which will cause plantar flexion. And this is actually why women wear high heels, because it makes the calves look tighter because we're holding in that same position with the toes down, heel up. If we were to take this one off, we can see more of that soleus and give a trick on how you remember or identify the difference between the two, since they're both in the same location. The gastrocnemius is the superficial one of the two, and it will come up and over, so it'll go to both sides at the knee. So now that we have the gastrocnemius removed, now you can see that that soleus actually only goes to one side. So if you're looking at something that only goes to one side, soleus, both sides, gastrocnemius. All right, and again, it was all about landmarking. So did you see how I started all the way in the front and then I just wrapped right around to see how everything relates to each other? That's a really good way to approach learning muscles. And then our next move is we're going to go back up into the back side of our thigh. And now we're going to have what is called our hamstrings. With the hamstrings, you're going to have two sides. The lateral side will have the biceps femoris. The medial side will have what we're going to call our semi-muscles. We have a semi-tendinosus because it starts to look like a tendon pretty high up. You can actually see the color change here. The semi-membranosus will peek through on both sides. It actually looks like a membrane because membranes surround things. If you were to look at a cadaver and not just this plastic model, it almost looks like a hot dog sitting in a blanket. So you have the semi-tendinosus coming through and then the membranosus wraps right around it. So that's how you find that one. So semi-tendinosus starts to look like a tendon. It's the one that's more superficial. Semi-membranosus will wrap around and you'll see it sticking through on both sides. We come to this side with the biceps. That means you have two heads. The long head is the superficial one. The short head is deep to that. So if you remove that, you'd be able to see it underneath. But I don't think I'm going to try because it will probably fall apart on me. Speaking of falling apart, this is about ready to fall off. So let's talk about this big one at the top. So your glutes come in threes. So we have on each side. So we have the gluteus maximus. That's the really large one. If we take this off, right underneath there is the gluteus medius. So the middle side. If we take that off, right, and then there's the gluteus medius coming off, and then there's the minimus. So the gluteus minimus is the smallest one. So they're layered just like that. So maximus, medius, minimus. And then this right here, underneath that is the piriformis, which is another one to know for the glute region. All right, that is your leg. Thanks for watching.